We all know that Cedar Rapids, Iowa City, and other urban areas across the state have access to big hospitals and high-quality medical care. For rural Iowans, that care may be harder to come by, but it is available.
Iowa has been tracking access to rural health care since the 1970s, in part to make sure as populations move to the cities, people who stayed in rural areas, like farmers and their families, still get the care they need. Even 40 years later, professors at the University of Iowa say the Hawkeye State might be the only one in the nation to track that kind of data.
Because of that, Iowa may be the only state able to gauge an unintended consequence of the Affordable Care Act. It all has to do with the specialists who travel to see patients in rural Iowa. Fox 28 News reporter Kevin Barry is here to explain why more coverage might not mean much.
Well, Scott and Tiffany, more coverage only is helpful if there is a doctor to see and pay in the first place. With changes to how doctors are reimbursed under the Affordable Care Act, rural health care could suffer. Distance might make the heart grow fonder, but not stronger. People who live in rural Iowa still need to see cardiologists and other specialists like surgeon Kevin Kopeski. He's worked at some of the best hospitals in the nation.
But the reality is I grew up on a dairy farm in Minnesota, and so I have a great deal of affection for rural communities.
Dr. Kopeski is based in Cedar Rapids, but comes to ANAMAOSA once a week to lend his skills to rural Iowans.
Most folks, if Jones Regional Medical Center weren't here, it would be a 40-minute drive into the nearest hospital.
He's one of a number of specialists who spends his own time and money to provide care to folks who can't make it to the bigger cities. Thomas Gruca at the University of Iowa studies rural health care and says while the Affordable Care Act is helping more patients get covered, it's changing the way doctors get paid.
Whatever may be implemented in the, let's say for Medicare, will probably be reflected in private insurance and in Medicaid. So how exactly all this is going to shake out, I don't think anyone really knows.
If reimbursements go down, it could mean even if more Iowans get coverage, doctors won't be able to travel to visiting clinics to see them because they won't get paid for it, which is tough on Dr. Kopeski because he says he wants to grow old here, and as things go, get sick here.
And hopefully we will get a system that allows us to compete for the best physicians, because we've got the best people.
Now it's just a matter of waiting to see how different parts of the Affordable Care Act will be implemented and how it all affects access to care, especially in those rural areas. Kevin Barry, Fox 28 News.